Today at Seeds of Soul, we are joined by Naina Singhania, a celebrated dietitian and nutritionist whose work has impacted the lives of 1,300 clients globally. Her customized diet plans go beyond than that of nutrition. They empower and heal. She specializes in healing conditions like PCOS, infertility, and diabetes. So let's dive in and hear it from Naina herself about her impactful work. Hey Naina, welcome to Seeds of Soul. And today's topic is something which is often misunderstood by the general public. It is about the role of insulin in our body. So how would you describe the role of insulin in a human body and what impact does it have in our overall health?
So this whole concept of, insulin, blood sugar levels, diabetes, all of these things, if I have to really speak in a very lame language for a common man to understand, I would give an example of, a house that has doors. You have your lock, you have the keyhole, you've got the key. So if I have to kind of compare it with the whole situation of the body and the insulin is, consider that as your key. Consider the keyhole to be the doors of the cells which are going to be used in order to open up. So just like when you're entering the house, you have something to, you're going to a wedding, you have to enter the house, you've got to get all your raw materials in terms of your jewelry, get ready, makeup, clothes, and get out. In the similar fashion, in the body, whenever you're eating the food, consider food to be that yourself. That food, to get into the cells, you need the key, which is the insulin. And that insulin actually needs to unlock the lock, right? The keyhole, it needs to get into that keyhole. Correct. And that is the time when that food that you eat is going to go inside and come out as energy. And that is how you function as a normal person. Now, this is something for somebody who doesn't understand. It's very simple that if there is an issue with the key or the keyhole or the lock of the house, is the time when diabetes comes into picture. And these are the three exact aspects: the problem in the insulin, the obstruction, and the problem in your cells entrance. These are the three places that will create that issue, and that is what we need to figure as dietitians or any health professional, that where is exact problem, and accordingly find a solution. So this is how diabetes actually happens.
So the next topic would be insulin resistance. What exactly is insulin resistance and how does it occur, and what kind of issues does it arise from insulin resistance? So
diabetes, again, for generic, from the aspect of understanding very plainly, two types of diabetes we all know: insulin dependent, insulin independent. Now, the example that I gave, which was the key, the lock, and the obstruction, it's like type 2 or insulin resistance is the place where the body is producing insulin, but the cells or the gate is faulty, because of which the insulin is not going inside. So the problem is not the key, the problem is the keyhole, or the problem is the lock. There is some obstruction at the gate, because of which the insulin is not able to enter in. So that is exactly what insulin resistance is. The body is producing fine as far as insulin is concerned, but its receptivity is a problem. So that is something that type 2 diabetes, and this is something that we can work around in order to make it better. And when I talk about insulin dependence, and that is when the type 1 diabetes comes into picture, where the key by itself doesn't exist, and that is the time when a lot of other measures needs to be taken.
So how is insulin impacting other lifestyle disorders like a PCOS, or maybe, like as we were discussing earlier, maybe even the big C? How is it impacting that?
Frankly, insulin by itself is actually the basis of functioning of so many mechanisms in the body. Again, talking very plainly, insulin needs glucose. Glucose is the basis of our being.
Correct.
We need it to function, we need it to think, we
yeah.
need it to breathe, for the heart to beat. Everything.
It's like the basic building block
Exactly.
of your system.
And imagine
yes.
if that basic building block is faulty or not functioning okay,
Yeah.
the body is not going to be okay. So when we're talking about insulin and the issues with that, it actually brings in a lot of other issues, be it hormonal issue, be it PCOS, as you said it, because in fact somebody who is suffering from PCOS, one of the normal medication that he's on is a metformin, which is for managing the blood sugar levels, be it infertility, be it cancer for that matter, be it estrogen dominance in women. All these aspects, the root cause or the starting factor is usually insulin resistance, because the body is absolutely confused or body is resistant, which you said earlier, the insulin resistance. That is where the body is struggling. It's not able to process the basic energy, and that is the time when all of these things start coming into picture one by one.
Wow. So then in that case, I think our lifestyle factors would also make a profound impact on insulin management, or on these lifestyle disorders that we are seeing that are so much on rise in the recent times. So what would be your comment on that? I mean, how much is insulin, and not many people know about it, that insulin and processed foods have a very direct impact. Yeah. So if you could enlighten us on that.
So again, diabetes by itself is, we all call it as a lifestyle disease, right?
Correct.
Lifestyle disease. And when we talk about lifestyle, everything that comes into it, be it your food, the way you're living your life, the stress factor that is there, the sleep that you're getting,
correct,
every aspect of it makes a lot of difference.
Yeah.
And that is exactly where the starting point comes into picture whenever you're trying to correct insulin resistance. The first thing that anybody will tell you is you need to work on your stress levels. You need to work on the kind of food that you're eating. It doesn't even matter whether it is protein, whether it is fat, whether it's carbohydrates. At that point of time, what matters is whether you're eating clean, whether you're able to sleep well, whether you're able to manage your stress, because again, stress is something that is, I mean, all of us have it, small level or large level. So that is something that is the starting point. And as rightly said, that because it's a lifestyle disease, the moment you start correcting it is the time when you start seeing the improvement. And it's a journey. You follow it for 3 months and then go back to the same place where you were in the beginning, it's not going to work. The diabetes is gonna, or the insulin resistance is gonna come back to you. So that is exactly what you need to, it's a lifestyle change that you have to make in order to see that difference. And then of course, then you dive in, you make a lot of other changes, you understand better, you understand your body better, and then accordingly work around it.
Yes. And what about the rise of, these lifestyle disorders, especially diabetes in the younger generations? You are seeing the onset happening at a very young age, and it's actually very alarming to see. So what do you think that that young parents or young people in general can do to avoid these lifestyle disorders?
So yes, we see it as early as 25, 26 years of age.
Correct.
When I think, and that is the point when this whole aspect starts coming into picture, is the time when there is a drastic lifestyle change. Again, from somebody who's studying, who's been working day in and day out, has enough sleep and all of that, and then all of a sudden he or she transitions into a place where there's immense stress, the sleep has gone out of the window, they're working literally 16, 18 hours a day, and that is the time when this whole aspect of, which we call as activation of your genes, which was absolutely fine. These things are the trigger points to activate it.
Activate those dormant.
Exactly. And that is the time when, these things starts popping in. Now, one of the interesting aspects is that a lot of us, think that it's a genetic problem.
Correct.
That diabetes
that my grandfather had it, my father had it, so obviously I'm just going to have it. Yeah. It's actually quite a myth, right?
So genetic, so I was going to come to that, and that is that the fact that when you call it genetic, yes, as health professionals, when we are actually asking you that, do you have anybody in your family or immediate family who has diabetes? The reason of asking is that your susceptibility as a person or your risk factor to get that definitely increases but that doesn't mean that you are going to get it. So again, a fact, as per researchers also, 25% of that risk factor actually comes from your genetics. The rest of the 75% is actually to do with your lifestyle, the food you eat, the quality of life that you choose. So if you think that I'm genetically predisposed and that is the reason why I'll just live with that fact, well, that's not true, because it's just 1/4 of that risk factor that is being contributed towards diabetes. So it makes a lot of difference to what is it that you choose at that point. And that is exactly in these youngsters today, at the age of 27, 28, when you're getting it, it's actually that lifestyle that is triggering that predisposition that I said earlier, and that is the reason why the symptoms come out so hard at such an early age.
That is so insightful and actually a revelation to me as well. So what do you think about the recent programs that one sees on internet about diabetes reversal? Is that a fad? Is that a reality? Can someone actually reverse diabetes? Is that even a possibility?
So I'll go back to that question that we had earlier, that it's a lifestyle disease.
Correct.
So when we're talking about diabetes and lifestyle being related, if you're correcting it, you'll be able to reverse it. But there is a condition, and that is, again, going back to the key, the restriction, the obstruction, and the keyhole. So what is the problem area actually is going to actually decide whether it's reversible or not reversible.
True.
So if the problem is the key, which means the pancreas is not producing insulin, it means that you can't really reverse it. You will have to take an external help.
Okay.
But if it is an insulin resistance at a certain stage in diabetes, where probably there is an obstruction, usually in type 2 diabetes, one of the aspects is probably there's a lot of fat accumulation around the cells, and that acts as an obstruction for insulin to go in.
Correct.
So if you're able to kind of work on that, the sensitivity improves, and there are chances that you will be able to reverse it. Whether it's nutrient deficiency, whether it's a hormonal imbalance, whether your gut is not functioning, depending upon what the issue is the time when you can actually comment whether you can reverse or not. And the second aspect is the type of diabetes that you are in. If it's an insulin resistance type 1 diabetes, you can. But over the period of time, as you advance as far the stages is concerned, it becomes tricky to really put, and that is the time when we have to go through number of tests in order to confirm whether we can actually work on reversing it or not. So there are a lot of terms and conditions that we have
terms and conditions apply.
a lot of aspects that we need to actually assess to be comment or be very confident about the fact whether we can reverse this condition or not.
So Naina, can you give us some everyday examples of how insulin impacts our overall health, especially mental, like moods and all?
So again, now insulin, if I have to speak in what are the functions of insulin?
Correct.
Insulin is basically working again on a very basic level of carbohydrate metabolism to give you energy.
Correct.
It's actually the other way around. It stores whatever food that you're eating as stores, and whenever you need it is the time when you utilize it. Now, one of the functions of insulin is also with respect to your brain. The thinking process makes a lot of difference.
Correct.
Now, when the insulin is not in its normal state, it's going higher or, because of high blood sugar levels, the body or the pancreas is continuously striving to produce more insulin. Now, the result of this is that the body has a lot of store of sugar, glucose, but it's not able to produce it into energy. It's not able to utilize it. And brain is one place that needs glucose to process so that it can think. Now, the moment the insulin is functioning to its highest potential, but the brain is not getting it because of that defect that I said earlier, it starts getting irritable. That is the time when you start feeling tired. A lot of people, they absolutely have no issues. They don't know that they're suffering from diabetes, but because of insulin resistance, they start complaining of feeling tired all the time. They don't have the energy. They want to do it, but they just can't get anything to execution. Or, in the morning when they're waking up, they feel very energyless. Or right after eating, a lot of them complain of bloating or complain of feeling sleepy. Why? Because they've eaten, but the food that they've eaten is not getting converted into energy. That is the reason that whole complaint of feeling sluggish all the time, feeling irritable, because it's not getting the raw material that it needs to think or to process or to perform the basic functions. And that is the reason this whole tiredness, irritability, low energy, mood swings, these are the very common symptoms whenever the insulin is on a higher side rather, and there is insulin resistance rather.
Correct. So while we have understood the role of insulin and we have understood its impact on our mental well-being, how much do you think does physical exercise, if you incorporate exercise into your daily routine, how much does that impact in insulin management of the body?
A lot of it. In fact, so I'm sure, as because we all read so much, cortisol or stress hormones is something that is very common. I mean, all of us must have heard of stress bahut hai. Cortisol level is one hormone that is actually antagonistic to insulin. While insulin will work towards reducing the blood sugar levels, the cortisol, which is your stress hormone, is going to do the other way around, which is going to increase the blood sugar levels in your body. Now, whenever there is stress,
flight or fight response.
Exactly. So when there is stress, the body is in an alert mode, keeping the blood sugar levels handy so that if there is any need, I can start using it.
Correct.
Now, the beauty of physical activity is that it works towards reducing these cortisol or stress hormones in the body, which by default is going to make sure that your blood sugar levels in general is not on a higher side, resulting in managed blood sugar levels. The second aspect is that it also activates one of these receptors that doesn't need insulin in order to go into the cell. So again, as I said, the cell requires, along with insulin, to go inside, process energy and come out. But the beauty of any physical activity, especially resistance training, is that it activates one of these receptors that doesn't need insulin to go in, process and come out as energy. It can just do that directly. So the physical activity is going to activate these two things. One, it's going to reduce the cortisol hormones, which is actually directly responsible for high blood sugar levels. And the second thing is it's going to activate one of the receptors that doesn't need insulin in order to process energy. So that is why if you are, in fact, we kind of suggest anti-gravity exercises and resistance training to such individuals, and you will be amazed if you're actually a fan of keeping a track of where your blood sugar levels are. Try checking it before and after these exercises, and you'll be amazed to see a drop of at least 30 to 50 points right after doing a physical activity.
Wow. So this is your cue to pick up a physical activity as soon as possible. Maybe get a new gym membership soon. Yes, thank you. So, if you could just give one piece of advice to our listeners as to how they could improve their insulin health, what would that be?
This is again something that we spoke about earlier, and that is, you don't have to figure everything out on the first day of managing your diabetes or your blood sugar levels. You've got to start small, and that starts with first cleaning up your eating habits. That's number one. The second aspect is getting yourself to move, which we just spoke about.
Yes.
And something that is going to be even more efficient is if you make sure that you move, especially 90 minutes after you've eaten any meal, because that is going to have a great effect on your blood sugar levels, postprandial blood sugar levels. And the third thing that you have to make sure that you include is good amount of protein and good fats in the form of omega-3 in your diet. Even if you start with these three things, you're going to see great change or difference or improvement in your blood sugar level, especially the fasting and the postprandial. If you're tracking, you'll be amazed to see that how these small things can make such a large difference in your diabetes management.
Absolutely. Thank you so much, Naina. This has been a truly insightful episode for us, and once again we thank you profusely for taking time out to spend today's afternoon with us. Thank you so much.
Thank you so much.